And once again, welcome to my Oet channel. Today, I came with an important information regarding Oet speaking. So, many students they have concern about non-case explanation in speaking module. There are a lot of non-case scenario. In some case, not I mean the role play cards. You can see that the child is present. The child is not present during the discussion. In some, you can see that they didn't give anything. So that means you are doing the presentation or doing the role play with the patient. So sometimes they used to give that you have just examined the patient, but the scenario is happening in rehabilitation center or nursing home, even in aged care facility. So in that scenario, how we have to present. In some other conditions, maybe it can come under home visit, and they may give like this. You have just assessed the patient. Now we are going to talk with the patient's spouse. So something it's give you more confusion how to start the introduction. So you know that if there is if they have given you have just examined means that is of course known case and no need for self introduction, but there are some scenario where you have to introduce yourself and you have to start the conversation as like normal way, but they used to give that you have just finished your clinical observation or you have just completed the assessment or something like that. Anyway, we will have the conclusion for all these questions and concerns. I will explain you in detail with the role play cards. So the first role play, you can see that it's happened in 24-hour clinic. This is the local clinic. The scenario between clinic, hospital, home and aged care facility or nursing homes are totally different. First, you have to think about the setting. Okay, so this is the clinic. You see a parent who has brought his or her 4-year-old daughter to the clinic because a rash has appeared on her arms and legs after playing at the park. You have just examined the child, so you mean this is non-case. And suspect urticaria, also known as nittle rash or hives. The child is not present for the discussion. So you have to make a clear introduction in this scenario because they have given that the child is not present for the discussion, but you have just examined the baby. So how we can start? So this scenario is happening outside the patient room or in the nursing station or in the corridor. So patient's identification is very much important. So here what you have to do, you have to ask baby's name during 3-minute preparation time. Example, baby's name is Maria. So how we can start? You can see the first task, find out more details about the rash. So you can start like this. You can start with your self-introduction. Good morning. My name is Rishmi Rajan. I am the in charge nurse for your baby. And if I'm not wrong, is it Maria's father? Like that we can start. Then from father's side, yes sister, I am Maria's father, and what about my baby's condition? Then we can start like this. Before proceeding further, may I ask you a name or how may I address you? Then you can continue the conversation. Like Mr. Matthews, I can really understand your concern about your baby, but no need to worry. Before proceeding, may I ask you some question regarding your baby's rash? Then you can continue with the first task. So this is a scenario if the baby is not present for the discussion. Then the next task is hospital rehabilitation unit. So take care, hospital rehabilitation unit or aged care facility or nursing home. Here visitors are the one will be the interlocutor because relatives will not stay with the patient in these scenarios, and they will come to visit the patient, and maybe during the visit or before the visit, maybe they will come to you and they will ask you. Sometimes after the visit they will come and inquire about their parents. So here you can see your patient is a 75-year-old woman who has been admitted to the ward following a stroke. Her speech and memory are impaired and she has limited mobility. You have just completed clinical observation. Clinical observation means vital sign monitoring. Her son or daughter asks you for advice about his or her visit. His or her mother is not present. Here also you can see that patient is not present. That means you are talking in corridor or in the nursing station or outside the room. So here also it is important you have to ask in detail regarding patient during the conversation. In this scenario, you can start like unknown scenario. It is not a known case. You can start as unknown. You can just start like this. Good morning. My name is Rashmi Rajan, one of the registered nurses working in this hospital rehabilitation unit. How may I address you and how can I help you today? This is the quite normal way. Then they will tell you that, good morning sister, my name is Matthews and actually I came here to see my mother. Then the confirmation is important. You can ask, well, Mr. Matthews, for confirmation purpose, may I know your mother's name? Then the conversation will continue as per the task. So rehabilitation unit and nursing home and even aged care facility, the scenario will be same, but you have to see that mother is present or no. If that particular sentence is not given, means this complete role play will comes under like a known scenario, because you are with the patient and the relative also with you. So the conversation will be in different manner, same like a known scenario. Okay, then in that case, how we can start? Example, they have given everything except his or her mother is not present, because you are clocking inside the room only. The first task is find out reason to request to see you. So here actually the first task itself, it is clear that it is an unknown case, because you don't know the relative and you are asking them, how may I address you and how can I help you today? Example, the first task is not there and the first task is give information about patient's condition, means this is non-scenario. So you will start like this. So the 3-minute preparation time, you have to ask about patient's relative name and patient's name also. Then we can start like this. Well, Mr. Matthews, from my clinical observation, I can tell you that she is in first stage of recovery and her vital signs are satisfactory. Like that, you can continue. So the first paragraph is very much important to confirm whether it is known case or unknown case and how will be the introduction. Then we will move to the another one scenario. And here they have given it is a patient's home. You are making a home visit to a patient who is suffering from chronic obstructive pulmonary disease and requires continuous oxygen. Mobility is now a problem. The patient's spouse has been caring for him or her at home for 2 years but has recently returned to work. You have just completed an assessment of the patient's needs and are discussing full-time care option with his or her carer. The first task is find out how the spouse has been managing since your last visit. So this is a peculiar known case and you are talking with the patient, along with the patient, but to the spouse. And here you have just examined the patient. So here no need for any self-introduction, you can just start, but you have to ask the spouse name and patient name during 3-minute preparation time. Example, you are talking to Maria and you can start like this. Well, Miss Maria, thank you for allowing me to examine your spouse's needs, and from my assessment I can tell you that he requires full-time care, but before proceeding further, may I ask you some questions? So like that we can start the conversation. Then another one scenario, it is community health center. You see a 66-year-old patient who is concerned about the varicose veins on his or her left leg, which have become itchier, increasingly itchy. He or she would like some advice. You have just examined his or her leg. So this is peculiar known case. You are talking to the patient only. So nothing is there to be concern more. You can just start, you can just ask the patient name during 3-minute preparation time. Example, you are talking to John, you can just start. The first task is confirmation. So Mr. John, thank you for allowing me to examine your leg. From my observation, I can tell you that you have inflammation of varicose vein. So like this it will continue. And the next task is hospital ward. You see the parent of a 7-year-old girl who has just had her adenoids removed and is due for discharge. You see the parent to discuss his or her daughter's discharge and to answer the parent's question. His or her daughter is not present. Here also you have to take care. Patient is not present. Daughter is not present. So your talk is going on in corridor or in nursing station or somewhere else. So the confirmation of patient's name is mandatory. And you can just start like this. Good morning. The first task is confirm the daughter's readiness for discharge. That means you are going to the parent and you are discussing. You see the parent to discuss. So confirm the daughter's readiness for discharge, post-operative recovery is satisfactory, and find out if the parent has any concern. So you are the one approaching the parent. So how we can start? Good morning. My name is Rashmi Rajan, one of the registered nurses working in this hospital ward. If I am not wrong, is it so? What you have to do in 3-minute preparation time? You have to ask daughter's name. Example, baby's name is Rose. You can start, if I'm not wrong, is it Rose's father? Then you can continue the conversation. Okay, Mr. Matthews. Then you have to ask patient, the father's name also. That means before proceeding further, may I ask you your name, or how may I address you? Then if it is Williams, means we can continue, or well, Mr. Williams, actually I came here to discuss you regarding the discharge process of your baby. Is it the right time to talk with you? Like that, we can continue the conversation. And the next one is the local clinic. You are seeing a 46-year-old patient who had surgery for appendicitis a week ago. Inactivity and past medical history has put him or her at risk of blood clots. So he or she needs heparin injection. These were started in hospital and have been self-administered since the patient was discharged 4 days ago. He or she is concerned about bruising at the injection site. You have just examined the patient. So in this scenario also, there is nothing to be think more. You can just ask patient's name during treatment preparation time. Example, John. You can just start like this. To find out more details about bruising. So you can start like this. Well, Mr. Example, John means, well, Mr. John, thank you for allowing me to examine your affected part. Before proceeding further, may I ask you some questions regarding your bruising? So like that, the conversation will go. And the last task is community health center. You see the parent of a 2-year-old girl who is going to have surgery next week to insert grommets in both ears. The parents has received a letter regarding the surgery date and pre-admission instructions. He or she has some concern about the fasting requirements, but the child is not present. So this is the community health center. Child is not present, and you are not you are not examining the baby, but they have given that child is not present. So why I added this point means you will get confusion how to start, because child is not present, whether we have to ask the baby's name, like that. In this type of question paper, actually no need for asking baby's name. You can just start like a normal unknown scenario, like, good morning, my name is Rashmi Rajan, I'm one of the registered nurses working at this community health center. How may I address you and how can I help you? Then the parent will tell the concern, and the thing will goes on, because this is a community health center and the baby is going to undergo the surgery in some other hospitals. So no need for confirmation of anything here. So you can just continue with the conversation as per the task. So I hope this video will be helpful for you, especially those who are nearing your exam. See the settings and the content what they have given in the first paragraph. Confirm whether it is known case or unknown case. Confirm whether you have to ask patient's name and parent's name. Then confirm how to start the conversation. So if you practice in this way, it will be very easy for you. And another one more thing, you have only 3 minutes preparation time. Don't waste time to think about these things and all. Just make it quick decision how to start, and you can just write nearby the first task how to start the conversation, so you will not get the starting trouble. And once during 3 minutes preparation time, if you ask parent's name and baby's name, write it down in the question paper. You can write the parent name in large letters and baby's name in small letter, because you are going to talk with the parent. And in case the parent is the patient and you are talking to the daughter or son, their name you can write it like a somewhat bigger size, and the patient name you can write it like a smaller size. So it will be easy for you to go through the conversation, because during the conversation, if you have gender changes or name changes, you will skip your B score. At the same time, conclusion also, you can just write it like a note, like a small note at the end of the task. So it will be easy for you to conclude in very easy way. So I hope you got some points from this video, and make sure everything is clear in your mind and practice well. Thank you for your time, and we will see you with another one informative video. Until then, bye, take care.